Hey guys, it's Amber and
Carrie.
we're here to talk to you about, yes, ladies, not boys, ladies. Okay, so endocrine system, the ovaries are grape-shaped, all right? They have some essentials, which are to maintain the health of the female reproductive system, and they secrete two main hormones, which we'll get into later.
The ovaries are oval-shaped and about the size of a large grape. They're located on opposite ends of the pelvic wall on either side of the uterus. The ovaries are each attached to the fimbria. It's the tissue that connects the ovaries to the fallopian tube. The ovaries are a pair of ova-producing organs, that is, they produce egg cells that maintain the health of the female reproductive system. The ovaries, like their male counterpart, are known as gonads. This simply means they are the primary reproductive organs. In addition to their role in producing ova, the ovaries also have the distinction of being an endocrine gland because they secrete hormones, primarily estrogen and progesterone, that are vital to normal reproductive development and fertility.
Alright, so estrogen and progesterone. Progesterone and estrogen are necessary to prepare the uterus for menstruation, which is a period to us ladies. Their release is triggered by the hypothalamus, which we can see through this cycle. Once you reach puberty, the ovaries release a single cell each month. This is called ovulation. The hypothalamus sends a signal to the pituitary gland to release gonadotrophic substances. These hormones are essential to normal reproductive function, including regulation of the menstrual cycle. If a woman is pregnant, the pregnancy will trigger high levels of estrogen and progesterone, which prevent further eggs from maturing. Progesterone is secreted to prevent uterine contractions that may disturb the growing embryo. The hormone also prepares the breast for lactation. More hormones are released during pregnancy than at any other time in a woman's life, but during menopause, which marks the end of fertility, estrogen levels fall fast. This can lead to a range of complications.
So we're just going to quickly go over some of the diseases of the ovaries when it's not working correctly. So we're going to start out with osteoporosis. Osteoporosis is commonly associated with menopause, just like mood swings and hot flashes. Menopause is marked by the rapid loss of estrogen. The role estrogen plays in bone loss can best be described in terms of a battle between osteoclasts, bone-absorbing cells, and osteoblasts, bone-producing cells. Estrogen is on the side of the osteoblast, but as the estrogen diminishes, the osteoblasts are discouraged from producing more bone. As such, the osteoclasts win by absorbing more bone than in being produced by the osteoblasts. So now we're going to go over ovarian cancer. Ovarian cancer is an extremely serious but rare disease. The symptoms usually don't become apparent until the cancer has progressed into the later stages. Symptoms of ovarian cancer include persistent abdominal pain, indigestion, bloating, abnormal uterine bleeding, and pain during sexual intercourse. There are common problems, so in the great majority of cases, they will not indicate cancer. However, it's important to pay attention to your body and discuss anything out of the ordinary with your doctor. So now we're going to move on to ovarian cysts. So ovarian cysts are fluid-filled sacs that affect women of all ages, though mostly women of childbearing age. Cysts are very common and they can range in size from a pea to a grapefruit. The majority of cysts are harmless, though larger cysts, those larger than 5 centimeters in diameter, may need to be surgically removed because large cysts can twist the ovary and disrupt its blood supply. Cysts can form for a variety of reasons. Some symptoms include breast tenderness, bloating, increased hair growth on the face, back, and chest, infertility, weight gain, and fatigue.
Overall, the ovaries have an immensely important role in not only female reproductive system, but in the endocrine system as a whole. The hormones they secrete ensure the proper development of the female body and promote healthy fertility, from when you're a baby girl, to when you're a grandma girl, to when you're a dead girl.